For the awareness of common society, how and when to intervene efficiently with autism cases? At what point and how can one begin with intervening?
See, I think before answering to that question specifically, I should say that there is a one point how to intervene.
Yes.
No? See, care should be taken at all aspects of see the child care, pregnancy care, pre-pregnancy care. Because you see, just think about the other aspect. The human life is becoming longer and longer in terms of the expected years or longevity, and the world around, everywhere, the aged population is becoming the biggest health crisis on one side, and the birth rate is slowing down, coming down. Less and less children are born.
Yes.
So that gives an idea about how precious our children are.
Yes.
So we can't afford the luxury of 50% of our children becoming some developmental, having some sort of a developmental problem. Because normally the number of children are coming down.
Yes.
Other side, the aged population is increasing. So preserving some sort of a balance, keeping some sort of a balance is quite essential. Every child born should be healthy physically and mentally. This is very essential for maintaining or keeping the social fabric intact. So every part should be taken care of.
It's not only treatment,
it is not about treatment alone. Treatment is the last part. Treatment is something like when we have no other way out, then I think we resort on treatment. Every aspect of this pregnancy, then the health of women in general, then young girls who are going to be the mothers of tomorrow or the coming years. So the reproductive health, the emotional support they need, the physical support and strength that they require, every aspect should be taken care of. So this is very essential. This is not a priority of luxury. This is an essential priority which is going to be the biggest question of human existence that way. In the healthy existence of the human beings on this planet. So I think this should be taken care of with a lot of seriousness, lot of urgency.
Sir, having decades of experience in dealing with autism cases, how do you deal? How do you treat an autism case? What is the? Can you explain it briefly from the starting diagnosing from there forward? Can you explain?
Yeah, see, I am some way or the other I am into the care of autistic kids for most of some 22 years now. So initially I think I was just completely, I have no idea about what these autistic children are or how they will behave or what can be done. So I think it was a very hectic journey, long journey. So I had to sort out the problem individually, one after the other. I have to make a lot of new trials, new attempts. I have to spend a lot of time on understanding the behavioral pattern of various children. So see, that it is based on that experience that I mentioned that we have to focus on 3 points: the mind, the Agni, the Ojas, and the Manas. So, this is going to be the basic thing what I am doing with every child. Interviewing the parent, observing the children and understanding what has happened. And from whatever we have extracted as information, as detailing, sort out them and place them in a proper manner to understand which happened first, which is primary, which is secondary, which is original, which is some sort of a reflection.
Yes.
Then slowly start sorting out them. This is the normal procedure which I follow with every child, and the gravity may be different, approach may be different, but this basic platform works with everyone.
Is there any standard protocol which you developed, or is it customized for each and every children, kids coming with autism?
No, I think, see, the basic platform, as I mentioned earlier, is now working as a protocol.
Okay.
And we see, just for our convenience, we call it as a Sunetri protocol for autism.
Oh.
That's all. So, see what we explained or what we tried to explain with each and every case, and refined multiple times, fine-tuned multiple
That
times.
serves as a protocol.
Yeah, that Sunetri protocol for autism.
Okay. Okay.
Yes, short form, Supra, or whatever it is, and that works with every children, every child, at least as the basic platform.
Okay, then it will be customized
According
to the
yes, because as I mentioned earlier, I think we will be sorting out the issues in such a way that the primary, secondary and the tertiary areas are isolated, and they are worked separately, and then their interaction is understood, and then the intervention is planned. So, this basic protocol works, but that is to be customized for every child. That is the only difference.
With your experience, how far an autism child can be reversed, or is it possible to reverse, or is there any is it connected with the grading or the staging of the disease, and what all stages we can say that we can somewhat reverse it? Do you have some comment on that?
Definitely. I think, see, because it is very interesting. These are all very interesting observations. We have plenty of observations. See how far a child can be taken out from the spectrum. It has got multiple influences, multiple factors which is going to influence the outcome. The first one is the early understanding that the child is having a problem. Then early intervention. So, diagnosis, early intervention. Then consistency. See, understand the problem, start the intervention, be consistent. For being consistent, the parents require a lot of support, because otherwise there will be a flooding of information which is quite sometimes contradictory. So, many of them will be running after various centers, various professionals, many things will be happening, many money, huge amount of money will be spent or lost. So, consistency is a very tough thing, but which is essential. Then definitely the gravity of the problem, which is mild, moderate. Okay, the chance of reversibility is very high, very severe, very severe. I think obviously, I think the interventions are also very hard, and the possibility of taking the child completely out of the spectrum is going to be a tough question. So, it is multifactorial, but having said that, I can say with some amount of confidence that it is not impossible to take a child out of a spectrum. It is possible when all these factors, that means the early diagnosis, early intervention, consistency, extraordinary social support and domestic support, class first therapy facilities. So, when all these things are coming together, definitely that child can be reversed to a neurotypical child. But that happens very rarely.
Yes.
That happens very rarely. So, the reversal is also very rare,
Very rare.
but that is not impossible. That is not impossible. In an ideal situation, when all these things are there, we have lots of cases in our records which came out completely from the spectrum, who is not going to be diagnosed as autistic anymore. So, it is possible, it is possible. I can say this statement categorically with a good amount of confidence.
Sir, while talking about the intervention, is your intervention, it will be like, is it an inpatient admission, or the patient staying in the hospital and you are treating, or it's like in the frequent interval, the patient, the relatives will be taking the patient to you and you are
Inpatient admissions are not essential. Complying with the protocol is more essential. See, when you comply with the protocol to the full, I think admissions may not be essential, but that is definitely going to support, that is definitely going to help. But for somebody who is not complying with the protocol, basically an admission has nothing to do. An admission is not going to do any magic for them. So, somebody who is complying with the protocol properly at one phase, after the initial induction of the child to the protocol and the basic things, then admission is going to be of great help. But for that initial stages are not done properly, admission has no role. It is just a waste of time and money. Nothing is going to happen. So, there are multiple things which are to be followed. You should follow a proper diet. You should make your child zero screen. You should engage the child in group activities. There should be one parent who is a full timer with the child, and the mental makeup of the parent or the caretaker should be very, it is very so crucial. Say a panicked parent is always going to be a very tough situation.
Okay, you are trying to correct that AOM.
Yes. Oh. Meantime, theoretically it is very easy, but practically I think there are multiple things, multiple things which should fall on track. See, even the parental counseling, reassuring the parents and explaining to them what is happening in each and every stage, explaining and convincing them what are the priorities in the next stage. These are all going to be very tough, but the total program is based on all these things. So, we cannot neglect any of these things.
Having said that, it is seen that whenever you are having such developmental issues, the parents, if they are having a good financial status, they will suddenly think about flying abroad and to settle in some other countries, developed countries. Like I have searched in the net, and it is saying that if you are going to US, it will be good for your kid with comprehensive resources. And if you are going to Canada, it will be good with inclusive education and a holistic approach in Australia. Like it is maybe this is thing which is taking these parents there. What is the status in our countries? How good is our care in autism? Whether it is the main modern facilities or with whatever you said with the traditional wisdom. How good is it? How available is this for the common public?
See, the system in our country is not that bad, but the problem is about the distribution of the facilities. All the facilities or all the required infrastructure is focused in the cities, especially in metros. In Kerala, I think the situation may be a little bit different. It has got somewhat an even distribution of these sort of things. But taking India as a whole, I think most of these facilities are confined to the city headquarters or district headquarters or the towns or the metro cities, whereas the periphery, there is no access for any of these things. And this obviously for these reasons, the service is quite expensive, and many of those parents in the periphery, they can't afford it. They sometimes they have to relocate themselves into the cities to avail these services. So, one of the parents will have to quit the job, family support will be minimal, expense is going to be twofold or threefold. So, that way I think it is not that bright, the situation is not that bright in our country, whereas I think relocating to another country is going to be equally disastrous in most of the conditions, because
kid.
again to the as far as the child is concerned, because see, you are going to expose to a different cultural background, to a different language background, to a different environmental setup, which is going to be quite challenging, and cost factor is also going to be a big problem. Unless and otherwise, I think you are well placed that way, I think it is going to be miserable. So, it is not a quick fix for all these issues, I think, but it is a general mindset in our country that okay, everything in India is inferior and everything in the West is superior. So, I think whenever you require something top class, the first choice should come from the West. It is, I think this field also makes no difference, that's all.
Yes. Sir, as we said, the other benefits or the other supporting factors, how good, like the behavioral therapy, how good it copes up with your protocol or your mode of intervention?
They are all
how important it is?
See, all these therapies are quite important, especially therapies like occupational therapy or behavioral therapy, speech therapy, all these things are very important, but they should be done by experts having lot of imagination to customize the program for the specific child. If that is not happening, I think it may be a waste of time and resource. Then all these interventions in terms of medicine and therapies which are Ayurvedic, the admission and everything which we were discussing earlier, is not going to replace any of these therapies like special education, occupational therapy. So, they should be complementing, one another, and I think as a whole this is going to make a big deal of difference in the total outcome. So, definitely I think the potential of these therapies should be utilized properly.
That means it's very important that the lifestyle modification is very important in the ongoing of that special kid. And do you have any specific advices to be implemented in such cases?
No, specific advices means, see, as I mentioned earlier, understand that the child has a problem, accept that the child has a problem, and take the responsibility to reverse the problem.
At every stage?
Yes. So, be consistent with it. Don't go for therapy shopping or doctor shopping, and don't go for unjustifiable claims and all those things. I think these are common with every child and every parent. So, being consistent and being following something which is having lot of background work done, trustworthy. So, I think these are fundamental things that you have to follow with everything.
Yes, sir. What are the common misconceptions about autism in the common society, and how to overcome it? As we are, the autism is like a very new term or very new development in our society. Have you experienced or have you observed any such misconceptions in the society being prevailing?
See, the misconcepts or misconceptions about autism, actually it is not something which is limited to autism. We have got certain preoccupations regarding various diseases. See, even epilepsy, I think we have got lot of preconceived notions about epilepsy. Then psychiatric diseases in general, we have lot of preconceived or preoccupied notions about it. See, we are living in a very traditional society, even though I think things are changing fast.